right. Here's a little bit about me. I started out my professional life as a medical technician. I grew up in Northwest Iowa. Went to Minneapolis to training as a medical technician. Worked in hospital labs after that. I might as well tell you, that was about 10 years. Then I worked in family practice residency clinics, and during that time I had gone back to school and was working full time, but I got my bachelor's, which then instead of being a technician, I was also a technologist. And that was both around Iowa and also in Omaha. And then since I couldn't get a job doing anything but lab work, I got it offered to work at the local public health department, Douglas County Public Health in Omaha, and thought it'd be a good transition. Maybe 3 years there with a grant, and I was there 11 years doing childhood-led program, case management, data, epidemiology. The picture is actually from the Omaha lead site, which was one of the largest residential Superfund areas in the U.S. It was over 20 square miles surrounding downtown Omaha. And there's nothing that says, we love you, like going to lots of community-based meetings with activists and not being able to talk about specific cases because of confidentiality, and you get beat up on really bad. While I was there, I went back to school at the University of Nebraska, Omaha, and got my master's in public admin. And the REHS stands for Registered Environmental Health Specialist, which is an environmental health degree. So after being there for 16 years in Omaha, 11 in public health, my husband really wanted to move back to Iowa, and so I was hired at the Iowa Department of Public Health to do occupational health and safety surveillance. How many of you, since you're in these programs, you're aware of the ag centers? Okay, the ERCs? Okay, they're both NIOSH funded, right? And there's the map. Okay, my program is too. This is called, a lot of times they call it the State Occupational Health and Safety Surveillance Program. We currently are only funded as a fundamental program. From 1995 through 2015, we had an expanded program, which included the FACE program, which is contracted to the University of Iowa. This data is still up on the FACE website. If you just type in Iowa FACE, you'll get to it. It talks about fatality investigations that were done. We also had pesticide surveillance from 2006 to 2015, but now we're only funded as a fundamental program, and that's where the other states are that are also that. So just a quick thing, make sure everybody's in the same wavelength. Environmental public health is not being an environmentalist. It's looking at how the environment impacts human health. And that's what child-led programs, when I was in Omaha, that's what it was part of the environmental health. And my program, Occupational Health, is also under the environmental health program. Here at Iowa, at the Department of Public Health, our bureau is called the Environmental Health Services. And you can see there, let's see if I get the right one. Oh, wrong one. Okay, so there it is. So the different things that are done, in a lot of ways, we're kind of, if it doesn't fit anything else and it involves environmental health, it gets put into us and stuff. At IDPH, we do not do the food inspections, although most of the local public health food inspectors are contracted by the Department of Inspection and Appeals to do that. In other states, they're part of environmental health. We also don't do sanitation complaints, mold calls, we take them, bed bugs, but we don't go out and do anything. We give people resources that they can do, but that's not actually something we do. So the occupational public health is kind of a description of what our program does. It's looking at basically using the data that we can find or collect, and then looking at it for ways that we can impact health and safety in the workforce. So these are the things that my program is supposed to do. Like I said, we're funded by NIOSH. We do what's called the occupational health indicators, and I'll talk about those in a little bit. The adult blood lead epidemiology and surveillance, I'm going to give you quite a bit of the data from that. I am responsible for monitoring all adult blood lead tests in the state of Iowa. Environmental and occupational reported diseases that are in the Iowa code that are supposed to be reported to us. Any of you that are working in a clinic, you might want to look at that sometime because I'm supposed to be getting reports. Pesticide surveillance is also in the Iowa code, but we're no longer funded to do that. We respond more on a as-needed basis. A couple years ago, City Marion was hit by a pesticide drift from an airplane, and we worked with the Department of Ag and the DNR, and then the local public health and the local fire and everybody else to come up with messaging and what should be this response. Because basically one of the things it came down to is, no, just because your tomatoes just came into season, you can't eat any of them. And then the fatality and assessment program, which is no longer funded. So adult lead in Iowa. Like I said, it's ABLES, Adult Blood Lead Epidemiology and Surveillance. We get marginal, just a little bit of funding, extra funding for doing that and reporting our de-identified data back to NIOSH. All our reports by state law, all blood lead tests have to be reported to the state health department. And our data goes by electronic lab reporting, if we're lucky, into a database called HELPS, Healthy Homes Lead Prevention Surveillance System. It's also known as Hopeless and Helpless. If you talk to the local public health people, it's been in place since July of 2014, and the bugs are getting worked out, but it's a slow process. An adult lead in Iowa or in the U.S. is considered anybody 16 years of age or older at the time of the test. And I review them all. They may be contacted, and I'll talk about that a little bit more. So elevated blood lead levels, we contact. Our big thing is trying to figure out what's the source of the exposure and making sure the person that's being exposed knows what the risks are from lead exposure. Our priority is new people that this is the first elevated blood lead level that's 15 or higher. And especially our priority is getting information out to people that aren't working for one of the major industries in Iowa that exposes them to lead, because people like work at the battery plants and stuff have occupational health nurses either in the plants or are working with a clinic that should be providing them information. We often contact medical providers first. Part of that is because they'll actually reply to me, and people don't always. They don't have to, so they don't always return my phone calls or letters. So we contact the medical provider, and under state code, the medical provider is obligated to provide the information back to me. It's a one-page form that I say, why was this person tested? If it was due to work, who's their employer? Or what do you think was the cause of their exposure? And then I code that all, and that's what gets turned into NIOSH. And then, like I said, the other thing is that a lot of the, especially non-occupational health docs, have never seen a high lead level. And so we want to make sure that they know who to contact. We usually refer people to Dr. Ed Bote with the Iowa Statewide Poison Control Center, or actually to the University of Iowa Toxicology program for if the medical provider needs a consultation on what they should be doing. The new EBLs, elevated blood lead patients, we may mail them information, an additional longer questionnaire, especially if their level's over 20. And we also try to target then what information we provide to them based on what we know of their exposure. We do not do on-site investigations. We don't have the regulatory authority. Sometimes if it's a work site, we do make referrals to OSHA. I will consult with employees or employers if they desire. Although if it's medical, beyond things that, like what's on one of the information cards I have down here, or what's on my website, anything beyond that, we refer them to Ed Bote or you guys at University of Iowa. And I'll network with the local public health, especially if it's both an adult and a child involved. So this is a reference chart that was put together by NIOSH, talking about, because when we say what's an elevated blood lead level, that has changed over time. OSHA still uses this definition, which was put into place in the 1970s. Even they know that it's not protective of health. So in 2008, they've had a national emphasis program saying trying to keep levels below 25, but the OSHA regulations still are the higher levels. Various occupational health groups, including the NIOSH group and our CSTE group and stuff, we look at a level of 5 or higher as being medically elevated or a reference level for public health safety. Okay, so here's how Iowa compares. Actually, this was done, the graphic was done by NIOSH for the 2014 data, and at the time they put it together, Iowa's data wasn't there because we were having a data security issue and had to get all the paperwork in place to be able to report to them. So I snuck our Iowa in there. But we are one of the top states by rate for blood lead levels that are higher than 10, and even 24. You can see how we compare to the national average compared to the Iowa, or the national rates, I should say, to the Iowa rates. So how come? You wouldn't really think about that. Here's the rates, another slide that I did at both 10 and at levels of 25. The good news is over the years, levels of 40 or higher are going down. And this is the bar graph showing at the various levels. This is from 2006 to 2016. I've been doing the last 5 years data analysis. And so some of these slides are from some of the analysis I've done so far. Here you can see we started doing it, showing what the levels of 5 are. I always tell people to take how many were 5 or greater with a grain of salt, because our old data system and even the current data system when it first went into effect did not do a good job of separating out those that came in as less than 5 or 5 and higher. It's just a data recovery and a data recording issue with electronic lab reporting. So these numbers, I looked at it actually at 6 and higher, and then at 5 and higher. I did the graph based on 5 and higher, knowing that some of those were actually less than 5 numbers, but it didn't make a statistical difference. So why does Iowa have high lead levels? This is how a lot of people outside of the state especially view Iowa. My favorite is John Wayne birthplace. Okay. This is the reality, and this isn't even near all the companies that use lead in Iowa. Iowa has a lot of companies, a lot of manufacturing that uses lead. And part of that is because a lot of the lead in the past was mined in Kansas and Missouri, and so Iowa's close by, and so businesses started up, and they continue to be used, even though the mines are no longer currently being mined. Some of the different industries that we see, and we see a little bit of everything. Typical Iowa exposure. This is looking at the 2012 to 2016 data. There were only 11 employers that averaged 5 or more workers with a level of 5 or higher over those 5 years of data. So it's really for the high numbers. If you went back for the total number of EBLs at 5 or higher or 10 or higher, then only 11 employers make up that. 10 of them are in the manufacturing sector. 1 is in a wholesale sector. The reality is that manufacturing is a fixed place business. And so OSHA knows where they are. It's real easy. They know that if they don't do testing, they might get inspected, right? Okay? If you're working construction, you're here, there, everywhere, you're not necessarily going to be inspected. And so we know that manufacturing is over-tested compared to that, but we're glad that as many that are testing are. They're large, this is what I was saying, they're a large fixed site employer. So out of those 11 employers, the 5-year average was 1,083 workers tested at a level of 5 or higher, and 886 were out of 11 employers. Like I said, owner-operators of small businesses are much less likely to offer lead testing to their employees, and that includes most of the construction trades, especially renovation repair. Artists, electronics recycling keeps popping up as more of a problem. Radiator repair. Actually, radiator repair shops are dying out. There's fewer and fewer of them in Iowa than you would think. And only 85 of the workers with levels of 5 or higher out of 448 workers tested that we knew of that were work-related and not in those 10 employers. So it's really the biggest shares in the manufacturing and 11 employers. Here's a graphic just showing how it breaks down. This is the less than 5 results, 5 to 9, 10 to 14, 15 to 19, 20 to 39, and then 40 or higher is only 1% of the test. This is the 5-year average, which is really great. It's getting much better than it used to be. This is how it breaks out by industry. Like I said, a big part of my job for NIOSH with this is trying to figure out, is this work related, and if so, what industry is it? And doing the coding, that's where we get these numbers. And so you can see the green is manufacturing. Okay, so major sources of lead exposure here in Iowa, construction workers. Even, this is from an OSHA document, and this is even what they say. A lot of things that I wouldn't have thought of as being occupation or construction are construction. Would you have thought that painting a bridge or a water tower would be part construction? If you're not working in occupational health, you probably don't think of that. But that's some of the most common things. This is also from the OSHA lead and construction one. Plumbers, welders, and painters are among the most likely to be exposed. And what they call industrial coating industry, which is the ones that work on the bridges, water towers, things like that, they have some of the highest exposures, although some of that's getting better regulated. If they're working in construction, the OSHA regs are based on you test the environment, and if you fall within a certain trigger area, then you're supposed to do medical monitoring. But even the OSHA guidelines themselves say, if you haven't done testing, you should just assume that if you're doing these things, they need medical monitoring, or they need to be using PPE or engineering devices to lower their exposure. In fact, that's another way to look at it. Hand sanding, power sanding, interior demolition are all much higher for how much lead exposure they're going to generate. So manufacturing, 90% of the EBLs were in manufacturing. It's only 25% of the adults that were tested. Lead storage battery manufacturing plants account for the majority of cases. Anybody know what are the major battery storage manufacturings in here in Iowa? Okay, there's 3 major ones and then a couple of little boutique ones. Exide, they're located in Manchester, Iowa, which is in Delaware County. They pull workers from at least 12 different counties. It's some of the best paying jobs in the area, okay? They're also not unionized. Very typical of Iowa, small manufacturing or manufacturing. They're an international company that puts plants in small towns because they got a good workforce, they don't unionize, and they got a good work ethic. The other big one is East Penn. It used to be called Voltmaster. Sometimes their products are referred to as DECA, and they are in Corydon, Iowa, which is down in Lucas County, or Wayne County on the southern border. Actually, some of their employees live in Missouri, or Missouri, as my counterpart down there says. But they're working in Iowa and getting exposed there. They don't have as many employees as Exide, but they tend to have higher exposures. The third major one is Johnson Controls. which is also an international company. They were actually brought into Iowa in about 2005. The plant was built in 2006-07 with economic development money. It's located in Red Oak, Iowa, in Montgomery County. Because they are a new plant, they have a lot of engineering controls built into the plant, and so they have not had a blood lead level over 25 since 2012. So it's possible to keep these workers from being exposed, but it's really hard to do in the older plants. Manufacturing is said more likely to be tested. It's fixed work site. And manufacturing sites that have sporadic exposure levels probably aren't doing testing because they don't hit the trigger. I have an automotive parts manufacturer in southwest Iowa. Once a year, international company, they would send out an industrial hygienist from the national office to do air testing, basically to prove that they were below the trigger level for OSHA and didn't have to do medical monitoring of the workers. However, they would have employee health fairs and offer free lead testing that the employees could take advantage of, and those would pick up anywhere from 20 to 35 people with lead exposures. And so I've worked with them to make them aware of the dangers of chronic low exposure, and they've actually instituted voluntarily gone beyond the OSHA regulations for stuff. But they're not, they don't have mandatory monitoring because they're below the trigger level. This, I know it's really small, but I just wanted to give you an idea. This is numbers I put together in 2015. The adult lead blood levels have been tracked in Iowa since 1993. And before, so this guy in 1993, he already had a level of 56, okay? He's got 126 blood lead tests in the database up until, I believe it was, February of 2015. He's still working, by the way, so he's got more. He was born 1956. He gets tested. Most of the battery plant people get tested anywhere from 10 to 12 times a year, especially depending what plant they work for. And you can see a lot of times what happens is when they're younger, they get the crappy jobs, which are also the better paying jobs. They're high risk. But if they move into management, sometimes then you'll see the levels start going down. That's because they're not doing the jobs that have as much exposure. But these people, we had one, OSHA actually, or NIOSH actually contacted me after looking at our data a couple years ago and said, do you know you have a worker who's had levels of 20 or higher for over 20 years in a row? And I go, yeah.
Is that 1990 number accurate?
Yep, 189. Okay, which most of these, let's see, there's some that are over 40, which was kind of the default, but 189. Yeah, he was chelated. Or that one could be a false positive, and they go into the database since it's the same day. This was probably a false positive. Yeah, which we do look at that at the time, but there's no way we can, because they say we can make notes, but it doesn't show up when you pull it out. One of the concerns I've had, and this is data was more from 2013, haven't gotten to look at it by years for the 2012 to 2016 data, is the number of women in Iowa that are being exposed in lead. Lead passes directly through the placenta, so if a woman has an elevated level, the unborn baby has an elevated level. And so we look at it, 13% of the cases in 2013 for women, and at that point it was levels of 10 or higher, we considered EBL, were women. And that was up from 11%, just 92 cases the prior year. The levels ranged from 10 to 73 with an average of 20. The highest EBL in 2013 wasn't related to work. It was actually a lady with a history of pica, whose level, she's had levels in the past that were over 100 from eating pottery. And that's the thing she admits to anyway, is eating pottery. Women in childbearing years, which is by CDC is considered 16 to 44, there were 43 cases, or 39%. and that was up from 30% the prior year. Women 35 years or younger, which are those that are even more likely to be having babies, was almost 22% of the women with elevated cases. And that was up from the prior year. And 107 of the 111 cases worked in battery manufacturing. I'm seeing even more of this in the last couple of years' data. One of the battery plants actually had tried to not hire women of childbearing years and got sued. So the way it's been explained to me is that as long as the woman knows that this is a risk, they cannot keep a woman if she applies for the job and qualifies. They cannot deny her the job because she's a woman and might get pregnant. Although OSHA also has it, if you read the information, the person's physician has a lot of leeway of saying they can pull them out of the workplace if they're pregnant or trying to get pregnant. So it's something that really needs to be run by OSHA and occupational health if you have a woman. And I've seen it with the battery plants where it's a 24-year-old, her levels have been in the 30s. Oops, now there's no results for 2 years. Now there's results for her again. I'm sure she took a year off to have a baby. In fact, looking at both men and women, in 2016 data, the green is for people that are 16 years of age to 35 years of age, and the blue is then the additional ones that are 36 to 40 years of age. So, but this is levels of 5 to 9, which is considered elevated, but I think of it as a red flag. Hey, they're getting some exposure. Same thing, the 10 to 19, and here's the 20 to 39, and there's quite a few people yet, and then the 40 plus. So a lot of young workers. And it's really heartbreaking because I'll see these young workers, they start working at the battery plants when they're 18. Then they always have a pre-hire blood lead, which is usually less than 2. Within 3 months, their levels are over 10. And within 4 months, they're usually over 20. And it's preventable. If we look at non-work exposures, we have different things up here. I'm going to talk about a little bit. So this is the non-work, or some of them are unknown, but it's very few of them. If we look at levels of 10 or more, most of them I've been able to identify what their exposure is from. And then some of the barriers to being able to identify what they're from is we just don't have the resources. Like I said, I'm the only person doing adult lead for the entire state. Lack of cooperation, some from the medical providers and some from the people. 2012 through 2016, lead tests that were 10 or higher, but were not related to work. So let's see, here's firearm exposures. They were doing renovation, repair, painting on their own property or not for pay. This percentage of the pie is for retained bullets fragments. This is from pica. This is from Ayurvedics, spices and herbals, mainly Ayurvedics. And then this is the percentage that was not known. Talking about Ayurvedics, and hopefully you've been made aware of this before. Ayurvedics, traditional system healing from India. There's nothing wrong with alternative medicine, but you have to do it safely. And unfortunately, what we're seeing is that if people are getting their products directly from India, we've had problems. And it's sporadic, so it's really hard to predict. This cluster was started in April 2011. A person was seen here at University of Iowa Neurology Clinic, 2-year checkup after he had a stroke. He was actually looked worse at 2 years out than he had when he was discharged. They did a heavy metal panel, and his lead came back at 93.6. The wife admitted that in their travels, and because they were looking for an alternative way to get better outcomes after his stroke, that they had traveled to India and were getting products directly from a clinic there. This product, which is and any of you here, I never say it right, Bahasma, and it's actually made, and they intentionally add heavy metals, but the belief is that if it's made correctly, it negates the negative properties of those heavy metals. This actually tested at 19,400 parts per milligrams per kilogram. Also tested at 1,430 milligrams per kilogram arsenic. Okay, he'd been taking this since the previous June. He was diagnosed in April. He was also taking this product, which had some exposure, but not near as much. So working with Dr. Fortes here at the University of Iowa, he gained the trust of a lot of the people in the Ayurvedic community, and they started turning in products to him, and he would write orders for them to get tested. And we ended up with, as of April 2012, that we had over 44 Iowa adults using the products were identified with having blood lead levels of 10 or higher. 4 people also had mercury poisoning. Most of the people were in their 60s. Most of these people were Caucasian, well-to-do. They were getting their products directly from India. They were not purchasing the products here in Jefferson County. And the results were actually pretty significant for the exposures. There's been at least 2 articles. This one is Dr. Gear Fuertes and a lady who was a grad student at the time. Her name is on that paper, and my name is also on this article. We also see lead exposures from firearms, firing ranges, casting, and reloading. And a lot of these exposures are hard to classify because is it a hobby or are they doing it for work? So we try to make that determination. So by firearms use, I mean they use firearms and they may be making or casting or reloading ammunition. And here's the data from 2012 to 16. These are 40, 20 to 39, 10 to 19, and 5 to 9. And these are the ones of people that will work. This scale here, you can see a little bigger. That 6 is the most there. This is 1.5 people, the average. We never even made it to an average of 2 for people that use firearms at work. Most law enforcement officials are shooting at safe galleries or taking the proper precautions, so we rarely see a law enforcement person that has an elevated blood lead level. The exception is if they're also doing firearms training or doing reload and casting of their own ammunition. Range employees, hobbyists. My favorite was there was an 86-year-old woman who I recognized her last name as being the same as the person who we knew was the manager at a firing range. And so when I contacted her internal med doc, it turned out she was his mother and she was helping him clean the range. And it was 86 years old and had a high lead level. Unfortunately, a lot of the places to shoot, especially indoors here in Iowa, are not retail businesses, they're clubs. And so the people that use it are also doing the cleanup and themselves. And a lot of them don't know what the risks are, how to do it safely. There may be an air system, there may not be an air system. So that's a very big concern. And I really don't care if people are using firearms, I just want them to do it safely. Just this year, we had an elevated one. A lady with her levels were in the 30s, and it turns out that there's a new business in the state doing ammunition wholesaling. They're buying spent casings and refilling them and shipping them out. And that's just the data that averaged out to 66 people per year are tested that were identified as using firearms and how it both work and non-work. We also see, and these are sporadic ones, making fishing jigs. These are usually a hobby, or either hobbies, or they're doing it as a cottage industry, where they're melting down lead in the basement and making jigs or sinkers. We had one gentleman a couple years ago that the way the doctor described it is, oh, in the winter he gets bored, so he makes toy tractors. This isn't a picture of one of his tractors, but just as an illustration, he was actually making replica tractors that were selling for over $3,000 each, and using not only the metal, but then lead-based paint, which sticks to the, that was, John Deere no longer uses lead-based paint, but that's what they used to use. And then the fishermen. If you have an old tackle box laying around the house from the days when sinkers actually were made of lead and not other things, it's contaminated. And so if you're like I was growing up and you're eating cookies and reaching into the tackle box, you probably swallowed lead with it. Automotive repair, like I said, there's fewer radiator repair shops in the state than there used to be, but they not uncommon to have high levels. Other things we're seeing that are work-related, like I said, electronics and scrap metal recycling, wholesalers, retailers, automotive repair. The highest case in 2012 was 97, and that was an automotive repair or a radiator shop. Leaded glass artisans, we've got a couple different businesses in the state, and actually it's less the workers in the shop and more the ones that are doing the window replacement installs because of how they're scraping out the old frames. Some transportation maintenance shops, railroads, and then other miscellaneous things. One of the problems that we worry about with adult lead exposure is take-home lead, and that's the ability for the person to take it home on the clothes, anything that settles on their clothes. Then when they pick up a child or have interaction with the child, that can be an exposure for the child. And here's a case that we had in 2011. A 12-month-old had a level of 30. That's really significant for a 12-month-old, especially they lived in a 1998 apartment. So there was no reason for that child to have that level. Dad worked at a firing range, is what we found out. So our inspector actually did dust wipes at the home and then on Dad to check for take-home lead. This is what she found. If you compare this to what's used as a clearance level for floors, is 40 micrograms per square foot. Dad's sweatshirt was 370. His work blue jeans was 340. The arms on the child car seat, which is transfer from Dad, getting the child from and putting into the seat, was 540. And his work shoes were 7,700. They could follow him through the apartment, see where he stored his shoes, where he worked, what chair he sat at the dining room table. The landlord was actually responsible for cleaning up the carpet. Problem is, if we didn't intervene with Dad, it would be contaminated all over again. So Dad was finally tested. He had never been tested, and his level was 22. And so we did refer it to OSHA. The first time they went out, they said that they were found to be in compliance, but after that, they were re-inspected and they were found not to be in compliance, and they were fined. This handout that's on my webpage, it's a front and back that talks about low-level chronic exposure. And this is part of one that I did for EBL training. So there were 837 people who had levels of 10 or higher in 2017. It's just more information. What we consider 5 micrograms per deciliter or higher as an elevated level or a public health reference level. Pregnant women and nursing women should keep their blood levels below 5. People with certain health concerns, especially high blood pressure or kidney problems, should keep their levels below 5. And there's no safe level both for adults and children. There's still level of 50 or higher is medical removal under construction. and 6 year higher is the medical removal level under OSHA for general industry. And then they can go back to work once it drops to 40, and then they go back into the same thing and it goes back up. And this is just a list of what was the highest blood lead level per year, the top two, except for 2016, and what the exposure was. Most of them were not, the highest ones were not work. The highest ones were hobbies or doing work on their own. We do have the Radiator shop owner in there, and then we have a club officer for a firing range. So occupational health indicators, we've got to go fast. So this is a set of 22 plus occupational health indicators that were put together, and I'm required to calculate them every year for the state of Iowa. This is just some information, types of things we pull off of it. This is actually now, that's 2014. In 2015 and 16, the CFOI data is showing a drop in fatalities here in Iowa. Here you can see some of the costs in Iowa, just from workers' comp. Here's just information on how we count most of the data now for the occupational health indicators, and the Bureau of Labor Statistics talks about full-time equivalent workers rather than number of workers, and so that's how we calculate what our denominators are. When we looked at inpatient hospital claims that were paid for by work comp, we saw that falls and transportation accidents were the two biggest things. The type of inpatient workers' comp claims were fractures, were by far the highest. Here you can see in the trauma registry, which is the trauma runs that are admitted to the hospital, we have non-farm and farm. There's fractures are more in that, but open wounds are higher for farm. And then this is the rate of fatal work injuries per 100,000 full-time equivalent workers. The blue is in Iowa, the red is U.S. Like I said, 2015 and 16 CFOI numbers have dropped, and so it's not a straight linear line anymore. When we look at our CFOI, Census of Fatal Occupational Injuries by industry, 32% are ag, farming, fishing, and forestry, and hunting, but in Iowa it's mainly ag. Manufacturing is, construction is next, and then the other ones going around. This is the one I like to show people because construction workers, here's this one, this column is the number of FTEs in the workforce by industry. So here's farming and here's construction. So that's 11% of the workforce in Iowa, but it made up 49% of the fatalities in Iowa, just those two industries. If you look at it by age and fatal injuries by age, so we have workers 45 to or older account for 47% of the workforce in Iowa, but they accounted for 68% of the fatalities. A couple other things, type of things, I was telling Bill earlier, it's kind of like anything that doesn't fit for something else, and if it's related to occupation, gets put on us. We've investigated histoplasmosis clusters, big one at Terrace Hill, workers that were pulling down chimneys or cleaning out chimneys, and a pile of bat guano at a manufacturing plant. That one actually ended up with international workers being exposed. We had a Q Fever Outbreak in 2008, and it was, here's some pictures, it was lambing facility, and so there was this really nice new modern lambing facility, and then hoop buildings, and they were building up a herd of 7,500 in these hoop buildings. Most of the people that were working with this had never worked with sheep before. These are the types of jobs they were doing, and they were actually delivering sheep, lambs, barehanded, no protective coats. There was no hot water in that nice new modern lambing building. They had to go through 3 doors to get to hot water in the lunchroom break room. And most of them, at the end of their shift, they just jumped in their car and went home with their dirty clothes stripped off there. So we not only had workers that were sick, but family members that were sick. And so we ended up with 43 people tested, 25 people were designated as a case of Q fever, which really scared them because they Google it and it comes up, this is a biological weapon and stuff. 6 to 67 years of age, both male and female. This was the interesting thing because first the workers didn't want to be tested and didn't want to talk to us. Then once one started talking to us, the other one started talking to us. And we're doing these interviews at the local public health, and they go, well, you know, there's a bus of kids out there doing a school, you know, out on the, let's see the brand new lambs, isn't this cute? So there were kids, school kids out there. And it was the end of the school year, so they had to try to track them all down and get information out. So there were cases that were living in 8 zip codes, 5 different counties. There were 2 cases that were hospitalized. I think one has turned into a case of chronic Q fever and stuff. So it was a problem. The thing with Q fever is there's really not a vaccine that's used here in the United States. We had to come up with recommendations. We actually called NIOSH in to do a health hazard evaluation. Electronics recycling at home. This was one of my weird ones. Middle-aged patient admitted with respiratory distress. On day 7 after his admission, they did a heavy mental panel. Day 11, they had an abnormal mercury result came back from the reference laboratory. There's just some information. Mercury is not good for you. Johnny Depp as the Mad Hatter and stuff. It was a problem been known as an occupational problem since at least the 17th century. The problem is this was a reportable disease, and the only reason we found out about it is because the lab sent the result to us. In fact, the medical provider, even when we tried contacting him, wouldn't return our calls for 2 weeks. We knew he was in the hospital and stuff. We finally found out, he finally got in touch with us, and the patient had been in the ICU on a ventilator for 2 weeks with acute respiratory distress syndrome. They blamed it on chemical pneumonitis, and that's also a reportable disease, but they didn't report that either. So by the time we got the information, the patient had been discharged to long-term care because he was still on oxygen. And he tells me this story that he and his son, they were both veterans, and they had decided to make some extra money by smelting old computer parts in his kitchen. And they had been doing it about a month. And those are the chemicals that they had ordered, either picked up at the local stores or ordered over the internet. He was very forthcoming with what, in fact, nitric acid, well, we had to pay $75 just to ship it to us because it's hazardous, but they're doing this. They did use some respirators that they got at the Army surplus store, but we have no idea what cartridges they were using on it. And they learned this technique from YouTube, and you can Google this and you will find lots of hits for it. We actually found the one that they had been looking at, and here's some pictures from it. One of the favorite things, this is actually something it says below the YouTube video part, is do not do this at home. They were doing it in a garage. Here's another favorite thing. See the coffee cup? He's using all these chemicals, including acid, bare-handed, and his coffee cup's right there. So like I said, they used a surplus military gas mask. They said they could use it about after 5 minutes, it would start burning, and they'd switch out the filters, but it kept burning, so it kept going. And after we went through all this, I said, but how did you get exposed to mercury? That's what I'm really contacting you about. Oh, I was watching the History Channel. I saw that the Colombians will mix mercury with dirt to get the gold filtered out. So I thought I would get some mercury and mix it with the sludge left over from the other process and see if I could recover more dirt. And he put this in a frying pan and heated it up. So he's volatilizing the mercury in his kitchen. And that's what actually made him sick. So 33 days from the date the patient was accessed medical care, we got hazmat out, and the mercury levels in the air in the home were still high. And this was anywhere from a month to 2 months since he'd started using the mercury. They actually made arrangements to air out the house and heat it up and air it out. I talked about this in the prior class. We see hoarding and environmental problems with public health. We don't really have time, but a lot of hoarding issues. Here's some pictures. This is actually my mom's apartment before she died. And she was found by a friend lying in a little area in the kitchen. They had to grab her by her ankles and pull her out to a spot that they could get a person on each side to carry her out to the ambulance. She refused any help. We had been trying to help her for quite a while, and she'd refused any help. Here's one. My boyfriend drank mercury. First, the girlfriend called Poison Control Center. Then the guy walks into the emergency room 5 days later and says, I swallowed mercury. And they said, yeah, right. And so they did a flat abdomen x-ray, and sure enough, it looked like mercury. So they treated him. They admitted him to the hospital. But basically all the mercury did is pool in the colon. So then these guys got involved, and they did a colonoscopy to suction out the mercury from his lower GI tract. And then we got involved because we said, what did you do with the residual mercury? First they were trying to flush it out with meds, and we said, where was he pooping? And they said, oh, right in the toilet. And then we said, and what did you do with the colonoscopy things? Well, we're not sure. Turns out that most GI labs that do colonoscopies deposit that directly to the drain. It does not go through hazardous waste. We actually turned out lucky, and they had captured it in a container and were holding it, and so we had them dispose of it as hazardous waste. However, when DNR, which you got to believe this was hilarious, we communicating with, up the chain, and I'm communicating with DNR and Department of Natural Resources, and what would you tell them to do? And they're all laughing. Well, this guy drank mercury, about 8 ounces of mercury, and he said he was depressed and that his Xanax made him do silly stuff. He didn't mention he also tested positive for marijuana and crack. Okay, so the problem is that the stool that went down the toilet actually passed mercury right into the waste system. He had a friend that would do construction odd jobs and would collect it, the flashing that's used in a lot of the old houses and the roofs. And he had, so that's how I got it. The detergent pod craze that's going on, everybody heard about this? Tide Pods came out in 2012. Concept's now been followed with all kinds of them. That's how many the American Association of Poison Control Centers had calls from 2013 and 14. They did a lot of things to restrict access so kids couldn't get into them as much. There was one death also. These types of pods are also used in dishwasher detergent, but that's food grade, and it's not as concentrated. So they might bite into it, but they're not going to get as sick. Okay. So in 2017, they started receiving reports. That's the stats of how much they had received for children less than 5. But they had 220 teens were reported exposed. About 25% of those they knew were intentional. And so it turns out that there were jokes going around social media and saying how they look like candy and they're good enough to eat and somebody should eat them. And so it became this new craze toward the end of last year and beginning of this year that you bite into it or you fry it up and bite into it and then spew out suds and everything else. And they filmed this and put it on YouTube. And so it's been so bad. Actually, the Iowa Control Poison Center has had 5 calls related to this specifically by mid-January. Nationally, they had 37 confirmed cases of this. There's all kinds of media out there now saying, don't do it. It's really stupid. but it continues to happen. And then here's the one story about the name of the session. So a man walks into a bar with a jar of mercury. This happened in July of 2012. Walked into a bar with about 12 pounds of mercury in a jar that he had found in a home. He was doing renovation repair work on this house that had recently changed ownership. He was supposed to found it on a wall. Of course, he had this jar of mercury in the bar, and it got spilled. Okay? So, we better clean this up. They grabbed the wet dry vac, tried to vacuum it up. Now they've got mercury fumes all through the bar. So what they picked up in the wet dry vac, they put it into another container, and the guy that originally brought it thought it'd be a good idea to bring it back to the house where he had found it and put it in the sandbox. Well, the following day, the new family that was moving in, they came over to see how the work on the house was going, and their kids found it in the sandbox. And now they've got exposures too. So it was reported. We ended up, the local people, the state people, EPA hazmat team was called in and brought in from the region to do the investigation and clean it up. There was extensive exposure found at the bar, partly because of use of the wet vac, and also at the home and the sandbox. They looked also at the home of one of the people working at the bar that had been working to clean it up because they knew mercury had spilled on him. And they had to remove the tile floor, place sealant over the subfloor, superheat the inside air, and force ventilation. And the wet dry vac was treated as hazardous waste and discarded appropriately. So they were decided that there was no cleanup in the home. Basically, they just opened it up and aired it out. They removed some of the soil and stand. The bar patron, they took care of that one. And they had to do medical monitoring and testing on all the exposed people to make sure that there wasn't any negative impacts. None of them tested high for mercury. And none of them had negative adverse health impacts, probably because it was reported pretty quickly after it happened. So their exposure was pretty minimal. And that has also been written up. It was an MMWR. It was in a lot of the newspaper reports, but also as one of a number of cases with a number of states put in mercury spills, and that was included. So here's one of my favorite. In public health, expect the unexpected. This was kind of a hoarder case, but not really. Basically what it was is when I worked in Omaha, our public health sanitation people went into a home with a multi-jurisdictional team. The initial complaint was cats. Turned out they were running in breeding cats and illegal cattery. There was also elder abuse and neglect and child neglect going on in the home. Well, one of my coworkers decided as they're walking down the hallway to open up the doors of side by side refrigerator freezer. So here's the refrigerator side, which you can tell does not look too appetizing. And there's the food right there, an open pan, Eggo waffles, okay? Guess what he saw when he looked at the freezer side? Oh. You recognize what that is? That's the tail end of a cat. There were actually 10 frozen cats in that freezer, along with food. Here's tater tots right up there. Okay? People do weird things, and we see it in public health. All right? So that brings us to the end. I pretty much made it 5 o'clock. By the way, I'm coordinating the Health and Safety Tent at the Farm Progress Show every other year when it's in Boone. So if anybody, I do work with a lot of the U.S.A. programs and stuff, but contact me. There's my business cards up here and a couple of information cards about my programs. So